When bleeding is severe, it can be dramatic and distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from their mouth or nose may affect their breathing, so try to ensure that the airway is kept clear. An obstructed airway can be a cause for the casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat someone unresponsive. To treat someone with a severe bleed, put gloves on, if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting or a plug to reduce the bleeding. Instead, leave it and apply pressure in either side of it to push the edges together. If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Faith, can you apply some pressure on the wound? Ask a helper to call 911 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock, so help them to lie down on a blanket or rag if there is one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Raise the leg if it is injured. Wait, I will lie you down and I will raise your leg. Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. Check the circulation by pressing their nail bed or skin beyond the bandage for 5 seconds. Release the pressure. If the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Blood shows through both dressings, remove them and apply fresh bandage ensuring there is direct pressure applied at the point of bleeding. Support the injured arm with a sling or bandage, but check the circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. And that's how we treat someone with severe bleeding.